Because when I started with the board in '95, we were simply a grant-making organization. By the time we got to 2000 and beyond, we had significantly more funds from the corporate, and we transitioned from just grant-making to programmatic things, and that to me is the most important part of my time on the board.
The number one chronic condition or illness is oral health disease for young people. You have to understand that there are such deep connections between what happens in your mouth from an oral health perspective and what happens across the rest of your body for the rest of your life. The indications, the influence, the power that a healthy oral hygiene practice every day instilled in the lives of a young person and carried on throughout your life has such an incredible influence on your opportunity to stay healthy and thrive and do all the wonderful things that you hope, dream, and plan to do with your life.
Oral health equity, when you're referring to American Indian tribes, also involves a trust responsibility.
Oral health equity is important because the communities that I serve really do have a lot of hesitancy around, accessing oral health, and by grounding it in culturally relevant approaches, we're able to encourage people to approach their oral health clinics, their dental clinics, and feel confident and seen, and that there's something recognizable about it. It's nice and refreshing to work with a foundation that gets it and make sure to take the time to understand and be in community with us. The Arcora Foundation is really easy to work with, and that makes all the difference in our ability to transform the health and the future of the health of our communities.
Arcora Foundation does a really great job of being a partner. I would be foolish to say that we didn't appreciate the financial support of the foundation, but it's always much more than that. One thing for me to hear from community members that they're lacking access to oral health care, but it's entirely another for me to track down the research to back that claim. And I don't have to track it down that far. I can just go to the foundation website and find that information, and I really appreciated that information being available and accessible and easy to read, as well as the kind of thought partnership of the foundation on how do we strategize to increase access to oral health at a policy level.
The foundation is integral to some of the work that we do at the University of Washington. Arcora has just been really a remarkable partner for us to have in the state. And, I don't think people realize that there are deltas all over the country that are regional, and their foundations don't really do as much as Arcora does. And I think that Arcora deserves some praise for all of the good works that you're doing in our communities, and we're really grateful.
Arcora has been an incredible partner in making sure that accessible messaging, accessible education, and powerful and inspirational ways of sharing good information about how to stay healthy from an oral perspective. Cool combination of tools, talents, messaging, and partnership have all been part of what I've experienced, and I'm very grateful to the Arcora Foundation over these past, 40 years of amazing service. I just really cherish an organization that reaches across every boundary, that thinks across every limitation, that considers every human being, every soul as cherished and precious in our society. I know there's a lot of us who could learn a lot from Arcora about that. So if Arcora ever wants to run for president, please let me know.